Erectile dysfunction is the difficulty attaining or maintaining an erection which is sufficient for sexual activity. That can be very different man to man. So for some guys, that can be you can get the erection, but you have difficulty maintaining it. For other men, it can be difficulty with the consistency and quality of the erection. And then for some others, it can even be just getting an erection at all. Erectile dysfunction is very common, probably more so than men like to admit. 1 in 4 men over the age of 40 will experience some degree of erectile dysfunction after the age of 40, and that only goes up year after year. It can be a very isolating experience despite it being quite common because men like to keep it private. Erections are very sensitive to a lot of different factors. The biggest factor will always be blood flow and vascular supply, but there's so many other contributing factors. Things like nerve innervation, psychological and emotional stress, hormonal status, all of these play into getting a good erection. And so because there are so many factors that contribute to it, anything that affects any of those factors will actually cause erectile dysfunction in men. Very common medical comorbidities, including diabetes, high blood pressure, any cardiovascular disease, the medications that you even use to treat those conditions, depression and anxiety can all affect your erectile quality. Erections can also suffer following cancer treatments for things like prostate cancer and rectal cancer. Erectile dysfunction is most commonly diagnosed based on clinical history and your own personal experience with sexual activity. However, there are also sexual questionnaires that exist that help us assess the severity and specific issues related to sexual dysfunction. Lab testing is also a very common part of my workup for men. Imaging also plays a role, particularly in men who have undergone prior surgeries in the pelvis or trauma. I often get patients questioning what they can do to help prevent erectile dysfunction or make their erections better. And my baseline recommendation is always do everything to live a healthy lifestyle. That includes a low-fat diet, regular exercise, and maintaining a healthy lifestyle that contributes to good heart health. Anything that really helps your heart is likely to also help your erections. You may be able to start your initial evaluation and treatment with a general urologist or primary health practitioner. A lot of oral medications exist out there, such as Viagra and Cialis and Levitra. These are now available in generic forms, so they're very affordable and accessible. Unfortunately, oral medications don't work for everyone. And when those fail or they don't really give you the result and reliability that you're looking for, you may benefit from evaluation from an ED subspecialist, such as myself, who can really do a more focused examination and treatment plan for you. There are many options out there for treatment of erectile dysfunction. Fortunately, the first and foremost option, which would be pills, are readily available and accessible these days. The generic forms of Viagra, Cialis, and Levitra can be obtained through a prescription from a primary health provider or a general urologist. When they work, it's great, but they don't always work, or they can also show a decline over time. When that gets to be a problem, then we move on to second and third line therapies. We may talk about things like vacuum erection devices or penile constriction devices. They are a great non-surgical, non-medical therapy that can be effective. However, as it sounds, it can be a little bit bulky, less spontaneous. For that reason, a lot of men move on to next options. That may include things like penile injection therapies. It's a much more direct delivery system for medication straight into the penis. However, once you get over that initial mental hurdle of putting a needle down there, most men seem to tolerate it pretty well. However, it may not be the most spontaneous option either, and some men don't like the feeling of a needle down there. So when that's the case, there are also surgical options that exist. Those include things like penile implant surgery. While that is definitely the most invasive option, it also tends to give you the most reliable and consistent result with spontaneity. That can be something that men may be interested in, and you may benefit from seeing an ED subspecialist to talk more about it. I always start by doing a thorough physical and history on each patient. I like to talk about what medications you're already taking, what you've tried, and what you've failed. We'll also do things like basic lab testing, sometimes imaging. Erectile dysfunction is such a personal journey that men go through. Everyone's history, everyone's experience, and even goals are very different, so there's no one-size-fits-all. We take it on a very individualized approach before we determine what's best for you. Oral medications can be effective and have a good satisfaction rate for men who have mild to moderate erectile dysfunction. Unfortunately, they don't work for everyone. Men specifically with a history of prostate cancer treatments, diabetes, and hypertension may actually have a lower response rate than the general public. When those don't work well, then we talk about things like vacuum erection devices and venous occlusion devices. Unfortunately, because of the bulky and less spontaneous nature of these, I have very few men who end up sticking with this as a monotherapy long-term for the treatment of their erectile dysfunction. Penile injection therapies have a much higher success rate than oral pills and vacuum erection devices. However, there are a lot of men who discontinue this therapy because of the uncomfortable nature of injecting with a small needle. For that reason, they may seek out more permanent solutions like penile implant surgery. For men who undergo proper counseling and choose to undergo penile implant surgery, the satisfaction rate for partners and their partners is upwards of 93%.